I'm just following up on your COVID-19 test results.
So you're aware that you tested positive?
This is Jennifer with the health department. I just received your email.
Jennifer Gottschalk is part of an army of public health workers trying to keep the coronavirus from spreading.
We would need a list of who this person was around.
They're fighting the worst health crisis in a century amid staffing shortages, slashed budgets, and public backlash over the pace of reopening.
Your safety can be an issue. We have been screamed at, we have been threatened.
Since the pandemic started, Gottschalk, a supervisor in the Toledo Lucas County Health Department, has worked 7 days a week, even when she was in the hospital and later at home recovering from COVID-19.
I was having problems breathing and talking and coughing a lot, and we all were working when we were sick, because when your pandemic team goes down, the pandemic is still going on. So you still have to work.
That work has become all the more challenging after decades of neglect in the public health system. An Associated Press Kaiser Health News investigation found that since 2010, per-person spending for state health departments dropped by 16%, and for local health departments by 18%, resulting in a loss of at least 38,000 jobs.
Years of disinvestment have left us vulnerable to disease and other public health threats in general, but especially vulnerable to this pandemic.
It's also put the well-being of public health workers at risk.
Just not having my sister around no more, it's gonna be a tough one. She was a young woman, 44 years old.
Shantae Mack worked in family health services for Prince George's County, Maryland. Her requests to work from home were denied. She was considered an essential employee. Labor leaders say she, along with 8 colleagues on her team, got sick. Mack died after 4 weeks on a ventilator.
She had all the phone calls and stuff she had to make and written on paper. So it really was, it was just a sad thing for them not to let them telework.
The economic fallout from the pandemic further threatens the work of public health departments with more budget cuts, furloughs, and layoffs.
If cuts continue, I don't know how much more each person can take on before things fall through the cracks.
We're kind of playing catch up at this point. It's concerning. I mean, we've lost 2 months of inspection time.
Non-coronavirus related programs have already been affected, from food inspections and vaccinations to mosquito control for West Nile virus.
We're about a month behind in applying larvicide to most of the public areas. The mosquitoes get to multiply unchecked, so we may have more mosquitoes in the community than we did this time last year.
But the pandemic response remains front and center as overworked employees try and find the balance to keep communities safe.
Somehow we always make it through, but if we have a second wave, that could become a very big struggle, not just here, but other health departments too.